I introduced Relfydess into my practice just over 6 months ago in May 2025. Since then, I've treated a broad range of patients within the licensed indications, which is the glabellar lines and the lateral canthal lines, and have gathered sufficient real-world experience to form a clear view of how this product is performing outside of the clinical trials. Reassuringly, the outcomes I'm seeing in practice mirror those reported in the READY-1 and READY-2 trials, both in terms of onset and duration, as well as patient satisfaction. So for any clinician adopting a new neuromodulator, it's always reassuring when published data align closely with everyday experience, and in this aspect, Relfydess has behaved exactly as expected. Let's talk about the onset of action. This has generally been quicker than many patients have experienced with their other toxins. Some patients have even mentioned noticing changes on the way home after treatment, although most begin to see visible effects within about 48 to 72 hours. If we look at the graph here, we can see that 40% of patients from the READY-1 studies noticed that they were starting to see effects within day one. In practice, I usually explain to patients that most people will experience a noticeably quicker onset of action with Relfydess compared to their previous toxin, but I'm always keen to hear their experience, as individual feedback helps me refine expectations for future patients. Importantly, I've also seen a very small number of outliers where the onset has been slower than their usual toxin, so it's really vital not to overpromise. A key observation in my Relfydess clinical experience has been in patients whose traditional toxin takes 1 to 2 weeks to take effect. Relfydess often brings their onset forward by about a week, which in itself contributes to an overall longer period of visible effectiveness in the total duration of effect. This earlier activity, while not universal, has been a helpful advantage when discussing treatment timelines with patients. Now, let's go on to the duration of action. So far, the longest duration reported in my patients, in my first cohort of patients, has been 5.5 months, with many patients comfortably achieving 4.5 months and some 5 months before returning for retreatment. When counseling patients, I emphasize that most people experience a longer duration of effect compared to their previous toxin, and it's usually between 4 and 6 weeks longer than their previous neuromodulator. It's really essential not to promise 6 months of full effect, because if we look at the graph here from the READY studies, we'll see that even though 75% of patients haven't returned to baseline, if we look at the graph between 4 and 5 months, that's where the effects tend to tail off, and that's when patients tend to come in for treatment again. So it's anywhere between 4 and 5.5 months where they come for further treatments. That is much longer than other toxins, for sure. Certainly longer than the Azilor patients and certainly longer than the Botox patients. So there is an added benefit. Now, what's been my patients' experience and how have they accepted the treatments? The most frequent comment is a brief stinging sensation during injection, similar to the experience with polynucleotides or indeed Profhilo. If you allow the product to warm to room temperature and you inject more slowly than before, it really does significantly improve comfort. Once past this momentary discomfort, patients consistently describe satisfaction with both the natural look and the longevity with results. Now, in clinical trials, about 70% of patients preferred the aesthetic outcome in the first month compared to their previous toxin. In my clinical experience, over 90% of patients have preferred Relfydess's look after their first month and during the treatment period, so 4 to 5 months, compared to Azilor, which is what I was using primarily in practice beforehand. When integrating Relfydess into the practice, it's brought a few operational advantages to my workflow. First of all, the workflow is faster because there's no reconstitution, there's reduced wastage. The downside is we can't hyper-concentrate the product or the dilution, so we can only dilute it further, which is really not indicated in many cases. Now, let's talk about some early observations with off-label indications. These observations are early, evolving, and should be interpreted with caution and not as definitive guidance. The frontalis area is still work in progress. It's widely accepted as one of the most technically challenging areas to treat with any neuromodulator due to the delicate balance required between avoiding brow ptosis, maintaining expression, achieving a smooth yet natural aesthetic effect, and ensuring durability. So my initial approach used similar doses and placements with Azelur. I then moved to placing the product slightly higher than Azelur to reduce the risk of ptosis. But in time, I noticed that Relfydess does behave differently from Azelur, particularly in the frontalis muscle, in terms of field of effect. It appears to have a slightly smaller field of effect, meaning that my usual injection maps for Azelur did not produce identical outcomes. In fact, to reproduce the desired effect, I've needed to use more injection points, maybe 6 or 8 injection points. And in fact, I've used higher doses than before. Initially, I might have been doing 20 Relfydess units. Now I may be going 40, 50, 60, 70 Relfydess units. I'm continuing to adjust parameters to strike the right balance between longevity and natural expression. The lower face is, again, with work still in progress. We're looking at the DAOs, the mentalis, the platysmal banding, and we found, generally speaking, longer effects and good sustained effects. I've had one patient where the efficacy in the masters was reduced, but most of them are happier. But I think work is still in progress, and certainly that's the general consensus with my colleagues as well. Now, who are the ideal patients for Relfydess? I would say that it's suitable for everyone, but it's suitable for those patients who perhaps don't get the longevity they desire from previous toxins. But so far in my practice in Relfydess, I've not encountered any safety findings that differ from what would be expected of botulinum toxin type A when used responsibly. So 6 months into integrating Relfydess into my daily practice, my experience has been consistently positive. The alignment between clinical trial data and real-world performance has been reassuring. Patient-reported satisfaction has exceeded my expectations, and I will continue to document and refine best practice approaches, particularly for off-label areas, as more experience and collaborative learning accumulate. I really do welcome comments on this topic. Please post them below so that we can all learn and enhance our understanding of this exciting new botulinum toxin.